Hi everyone, welcome to Vcodemy Medical Coding Training. Today's topic is ICD Chapter 1 HIV Coding Guidelines. So before we start off on the coding guidelines for HIV, do you know the difference between HIV and AIDS? Human immunodeficiency virus, that is HIV, that is the virus that causes acquired immune deficiency syndrome, which is AIDS. HIV weakens the immune system by destroying the T cells. So until the body is unable to fight off even minor illnesses. Sometimes the patients will have HIV virus but without any symptoms. They are called asymptomatic patients. So if a patient is documented with HIV disease, HIV related illness, or the term AIDS is used. Like AIDS is currently managed on anti-retroviral medications. You have to assign the code B20, human immunodeficiency virus disease. If a patient with documented HIV positive status is currently managed on anti-retroviral medication, assign the code Z21, asymptomatic human immunodeficiency virus infection status. In the absence of any additional documentation of HIV disease, HIV related illness or AIDS. So if a patient is asymptomatic without any mention of any HIV related symptoms or disease conditions, or the term AIDS is also not there, you can go for the code Z21. HIV coding guidelines. So now we are entering into the core subject. B20 HIV disease is used only for symptomatic patients, patients who display the symptoms, classic symptoms of HIV like weight loss, immunocompromised status, their immune system is very weak, and also some of the diseases like pneumonia, Kaposi sarcoma, which are all opportunistic infections. Whenever the immune system is weakened, such diseases will take control of the body. So if all that is present, you can use the code B20. So use the B20 code only for symptomatic patients or any conditions resulting from the HIV, or if the term AIDS is there in the medical record. Once a patient has an HIV related illness, always code B20 for every subsequent encounter. A patient who's been coded as B20 will never revert back to Z21. Hope that is clear. Example, a patient is admitted to the hospital for repair of an open fracture type 1 of the head of the left femur. The patient has been previously diagnosed with symptomatic HIV. So the patient is admitted to the hospital for an unrelated HIV condition. So what are the codes and what is the sequencing direction? S72.052B. This is for the repair of an open fracture of the femur, of the left femur. And also you need to add on a secondary code B20 to inform that the patient is a symptomatic AIDS patient. So always check whether the patient is symptomatic or asymptomatic. So the coding guideline states code only the confirmed cases. So in this context, confirmation does not require documentation of positive serology or culture for HIV. The provider's diagnostic statement that the patient is HIV positive or has an HIV related illness is sufficient. You need to use the code B20 for confirmed cases of HIV. a patient presents to the ED with a cut on his leg, he is a confirmed AIDS patient as documented in the record. So what are the ICD codes? Here you have to check the sequencing. Out of the 4 options, which is the correct option? You have B20, then you also have the code R75 and also Z21. These are different codes which are used to denote the symptomatic HIV, asymptomatic HIV, or inconclusive lab testing results for HIV. So please check, take your time. So the right code is S81.819A, and the second code, secondary diagnosis, is B20. So B20 is not the principal diagnosis here because patient comes in for unrelated HIV condition. Option C is the correct answer. Hope all of you got it correct. So this is the HIV coding sequence. So when you take up a chart coding for HIV, the HIV patient is admitted to the hospital. Check whether the patient has any HIV related illness, or he is getting admitted for an unrelated condition. So HIV related or unrelated HIV condition. If it is HIV related condition, then B20, that should be the principal diagnosis. The secondary code, additional code, will be the related condition. Due to the HIV virus, he has some other condition like pneumonia or Kaposi sarcoma or weight loss or any other opportunistic infections. Any chronic conditions like diabetes, they may also be aggravated due to HIV. So all that can be the secondary codes. If the scenario is like patient is admitted for an unrelated HIV condition, then the unrelated condition is the principal diagnosis. B20 will be the secondary code. So hope this is clear. First you have to check whether it is HIV related condition or HIV unrelated condition. That is very crucial. So when would you be using the B20 code? When the patient is documented as having AIDS, acquired immune deficiency syndrome, or HIV, and the patient has HIV related symptoms or any disease, you will be using the code B20. This is only for the symptomatic HIV patients. B20 is human immunodeficiency virus disease. When should code Z21 be used? If a patient with documented HIV positive status is currently managed on antiretroviral medication, assign the code Z21. Asymptomatic human immunodeficiency virus HIV infection status in the absence of any additional documentation of HIV disease, HIV related illness, or AIDS. The patient will have a statement like the lab result is positive for HIV. The blood test report alone states that the patient has he is a carrier of HIV virus, but otherwise he is perfectly healthy without displaying any symptoms or signs of HIV. Asymptomatic HIV, you will use the code Z21. During pregnancy. So what are the codes for a pregnant patient who is HIV positive but asymptomatic according to the guidelines? The principal diagnosis code will be O98.71, and of course you have to refer to the tabular list, the O98 category, to complete the code. This is not a complete code, that is why the hyphen has been placed there. This is used, and this code O98.71 will be followed by additional code Z21 for HIV positive status. This is for asymptomatic patients. Only the code Z21 is used for asymptomatic HIV in pregnant women. The code B20 is used for all HIV cases regardless of symptoms. The coding process does not require any additional codes for pregnant women. So pregnancy in a HIV patient, you have to follow this guideline. So O codes always have the sequencing priority. You must be aware of it. So we have been talking about related HIV related condition, HIV unrelated conditions. So what are the examples of HIV related conditions? So that you understand, HIV related conditions are like pneumonia, unspecified organism J18.9, tuberculosis of other sites A18.89, sepsis, unspecified organism A41.9, candida stomatitis thrush B37.0, herpes zoster rainy site B02.9, encephalopathy unspecified G93.40. Apart from this, you also have other HIV related conditions like tinea cruris B35.6, anemia unspecified D64.9, underweight R63.6, acute lymphadenitis L04.9, arthropathy unspecified M12.9, splenomegaly not elsewhere classified R16.1, weakness R53.1. These are a few of the conditions which are HIV related conditions. This is not an all comprehensive list. So when the patient displays any of these conditions, HIV related condition, use the code B20. Coming to HIV unrelated conditions, this can be like a trauma, like an accident, a burn injury, and also pregnancy, which is unrelated to HIV, so etc. Example, a 23-year-old patient presents to the emergency department with a cut on his leg. He is confirmed AIDS patient as documented in the record. What ICD-10-CM code should be reported? S81.819A followed by B20. So for unrelated HIV conditions, if the admission is for unrelated HIV conditions, the unrelated condition code will be the principal diagnosis followed by the HIV code B20. These are a few updates in the fiscal year 2026. Some revisions for the HIV guidelines are there. In chapter 1 C 1A 2A. This tells you to assign the B20 HIV disease code when the physician documentation indicates the patient has acquired immunodeficiency syndrome AIDS, HIV, or if the patient is treated for any HIV related illness or is described as having any conditions resulting from the patient's HIV positive status. This is an update. And chapter 1A to C, this adds more clarification that you can assign the B20 as a secondary diagnosis of patients with HIV who have been admitted for unrelated conditions such as a traumatic injury. For the guideline revision, the same is now going to be true for other documented conditions also. And another revision is E. This clarifies use of Z21 asymptomatic human immunodeficiency virus HIV infection status. You are told to apply the code when HIV positive, HIV test positive or similar terminology is documented and there is no documentation of symptoms or HIV related illness. And also you can in chapter 1 A to F still tells you to assign R75 inconclusive lab evidence of HIV for patients with inconclusive serology of HIV. However, the language, but no definite diagnosis or manifestation of the illness has been deleted. Patients previously diagnosed with HIV continue to assign B20, but now the diagnosis will have to be documented and not previously known for the guideline revision. And H, that is chapter 1A to H, tells you to assign O98.7 human immunodeficiency virus HIV disease complicating pregnancy, childbirth and the puerperium only when a patient presents during pregnancy, childbirth or the puerperium with documented symptomatic HIV disease or an HIV related illness. Also assign Z21 for pregnant patients, patients giving birth, and for patients during the puerperium who are either HIV positive and or who have documented asymptomatic HIV. See, if a patient, this is I, that is chapter 1A to I. Under that, the language changes from if a patient is being seen to determine his HIV status to if a patient without signs or symptoms is tested for HIV. That is, without any signs or symptoms, the patient comes in and asks for a test, HIV test. The reason will be high risk behavior. Some circumstance, the patient suspects that maybe he's been exposed to HIV virus. Some high risk behavior may have been there. So you have to use Z11.4 and the next code. If applicable, if any high risk behavior trend is mentioned in the medical chart, you can add on as secondary code. Additionally, for patients with the signs and symptoms they are presenting for testing, you have to use the code Z71.7. That is for counseling. You are now told not to report Z11.4. Encounter for screening for HIV. Those who come in with symptoms of HIV and they say, I want to be tested for HIV, then you have to use only Z71.7. Do not use Z11.4. Z11.4 is for patients who come in suspecting they have been exposed to the virus, but they do not display any symptoms. So that is a change. So documentation specificity is critical. So always look for the exact terminology to assign the codes. And after you read the document, still you have some doubt, it is better to place a query to the physician as a caution. You can feel free to contact Vcodemy Medical Coding Training for more detailed explanations and also clarify your doubts regarding any topic in medical coding. The contact number is displayed 9944478988, or you can even email vijayarani.s@vcodemy.com anytime. Thanks for watching this video. Have a nice day. Bye.